Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. It is April the 30th, the last day of April. We've been doing COVID now for well over a year, and there's lots of COVID fatigue. So if people don't want to stay for the whole hour, I totally get that. I know fatigue is here, but we've got some really interesting things to talk about today and some great questions that we'll try and answer today. So as always, the best way to get your questions answered is to go through Facebook questions at douglaspublichealthnetwork.org. I kind of screwed it up last time, but Facebook questions at douglaspublichealthnetwork.org. And if you send them in there, we get a chance to review and research them. And there's one today especially that I spent an hour or so researching, and I think I have a good answer for you. But you can also put them in the chat section. The chat section, we have to truncate them a little bit. So if you have a long question, do it at Facebook questions. But again, we'd like to get as many questions as possible. We always try to be nice to people. I would hope I've not been in any way denigrating to people when I answer questions. So as always, we start at the world view and then move down to the local view. And it's a funny week. It's a funny and not a good way week. It is the worst week ever for COVID. We have had more cases in this last week than ever before. So as you'll remember, there was a little peak in March and April of last year, another one in the summertime, another one in the fall, and then it went down. And now there's a huge fourth peak, which is bigger than the third peak. And this fourth peak is interesting because this fourth peak is in places that didn't necessarily have big peaks before, although there are some places that had all four. So for example, when we look, it's really, really active in India. So the number of cases, 20 or 30 per 100,000, probably much more than that. But in a country of over 1 billion people, that's a lot of cases. And in India, they're running out of equipment, they're running out of oxygen, they've run out of tests. So we don't even really know how many people in India are sick, but at least reports from the outside suggest a really dire situation. So in every country, there are embassies. So there's a U.S. embassy in India, and apparently many of the people in the embassy are sick, and they're telling Americans that are in India to leave if they can. That's problematic because when you tell people who are in a country where there's a lot of disease to leave when they can, they'll frequently move the disease with them. And I think when we look at our first two peaks, our first peak clearly came from China, our second peak clearly came from Europe, and it mostly came because they said we're closing the borders at the end of the week, and then people who were in those areas left quickly, and as they left quickly, they brought the disease back. Also really strong in Iran, Turkey, in the Middle East, and then Sweden and France in Europe. So Sweden, France, and Turkey, which is on the border, is really struggling with the amount of disease. So again, we'll remember we've talked about this a dozen times, Norway, Finland, and Sweden in the middle of the two, Sweden about as many people as on each side in Norway and Finland, and Sweden took a different approach. So Sweden took let's not do very much, let's build up herd immunity, and that herd immunity may be hard the first time to build up, but it'll protect us in the second round. It really has not worked out. So not only did they have a lot more cases in the beginning, they're having a lot more cases now, whereas Norway and Finland are down about where Douglas County is. And so the herd immunity, at least in that way, didn't work out. And then South America is just ablaze. So South America, including Brazil, Peru, Argentina, Uruguay, are some of the hottest places in the world with really high death rates. So to look at it overall, both Peru and Brazil actually have had more deaths per million than almost anywhere, certainly more than the U.S., and about 4 times the world average. So Peru and Brazil really, really, really struggling. And then on the other side of the world, Southeast Asia, Australia, New Zealand, Taiwan, Japan, basically all of Southeast Asia with Indonesia, Vietnam, Cambodia, Thailand, all with very low case rates. And they've not done this through immunization or any kind of magic. They've done this through careful quarantine and other measures. But then, 2 countries that previously had a really bad third peak, the UK and Israel, embarked on very aggressive immunization campaigns, and both of them have very low rates of disease. So it looks like if you either have really strong public health measures or really strong vaccination efforts, or a combination of the two, that you can get your case rates down. And I think that's what we're seeing in the U.S. In the U.S., We're at 32 million cases, 574,000 deaths. Cases are clearly coming down. So we had a first wave, a second wave, a third wave. The fourth wave was just a little bump. It was just a tiny little bump, and it's now coming down again. But it's come down at sort of a high level. We're having 700 deaths a day. So still, we're having a lot of people dying and a lot of people in the hospital. In the U.S., still very active in Michigan, Minnesota, Texas, and Florida. And I'm sad to say now Oregon. So Oregon, which has really done very well during most of the pandemic, is really struggling, and especially Eastern Oregon. I heard from a friend in Deschutes County that they're having more cases this week than they have ever had. That's funny. And they're having more cases than they've had, despite the fact that they've got a reasonably good immunization rate. And I think it's because the variants are out there. The variants are now clearly here in Oregon. And when the variants get to your area and you start to have a little outbreak, it's going to spread. And I think that's what happened in Michigan and Minnesota. There's part of Tennessee, parts of Texas that had that there are these big outbreaks. I just think these other areas have just not had big outbreaks of the variants yet. And I'm worried because the immunization rates in some of those places are low enough that if it starts going, it could be really pretty bad. So as I said, Oregon, really not looking good. Lots of disease and hospitalizations, up to 350 hospitalizations. That's a lot. That's lower than the 500 or so that we had in the wintertime when we had our bedtime, but it's a lot of people, and 71 in the ICU. And more of these people are younger, more of these people are, they're not seniors. So when we look at our group of people in the hospital, there's one person in their 70s, and then everybody else is in their 20s, 30s, 40s, and 50s. So that it's a much younger group who are being hospitalized now, and that's a very, very, very worrisome thing. When many older people got sick with COVID, they got sick with COVID, and they recognized they had a poor chance for survival, and many of them chose to not go to the ICU, not to do heroic care, maybe even go home. And that's why, if you look at our deaths, a good number of those deaths were people at home because they chose not to be really invasive. A 30-year-old is not going to choose that. A 30-year-old is going to say, do everything, as is appropriate. And when you do everything in a 30-year-old, that really uses a lot of work, a lot of equipment, and uses those very hard to come by ECMO machines, those extracorporeal membrane oxygenators, these basically the heart-lung machines that do seem to work for people with COVID, but it takes days or weeks or months even on these machines, and there's only so many of them and the people to run them. So that's the real worry. Douglas County, we've had this up and down in the last week. Today just 3, but yesterday 17. Our numbers are maybe slightly going up, but they're still among the lowest in Oregon and still one of the lowest places in the country. I looked at our doppelganger communities, and we're not much lower, but we're lower than the other doppelganger communities in the area, and still about a third of the death rate in those other areas. Testing still widely available. Really no reason not to get a test. So if you think you're sick, please just get tested. There's some people say, I don't want to get tested because I don't want to raise the numbers. Again, not knowing whether you're sick or not causes so many other problems that please get tested. Your positive test is not going to really screw up the numbers that much. In terms of vaccines, all of the vaccines are back on the table, the Pfizer, the Moderna, and the J&J. We started giving all of those vaccines again, and we're really encouraging people to get those vaccines. Again, we've looked at the safety of those vaccines, and they've really been carefully scrutinized. What we're seeing is that the Pfizer and Moderna clearly have some risk of allergic reaction that could be treated with EpiPens and other things, that people clearly have local reactions to the Pfizer and the Moderna, but really no other big safety signals. With the J&J, there have been more faints associated with that vaccine than with other vaccines, and there's this rare couple in a million clotting problem that seems to be mostly women and people under 60. So other than that, the safety out there of this is great. When you compare this to the safety of so many other things we do, this is a very safe vaccine. When you compare it to Viagra, or compare it to an antibiotic, or compare it to many of the other things that we do without much of a thought, this is a very safe and very effective vaccine. All right, well, let me get to the questions here and put them in the section, and we'll take a look. There we go. So the first question is from Andrea. How many droplets does it actually take to get COVID? This is a great question. It takes about, typically for the viruses like this, it takes between 1,000 and 5,000 infectious particles. That's viruses. So it takes that. And then the amount of viruses per droplet depends upon the size of the droplet. Some droplets will only have one virus in it. Some droplets will have maybe a dozen or even 100 viruses in the droplet. Again, the bigger droplets tend to drop quickly. The smaller droplets may float in the air a little bit further and get there. The thought is that it probably takes 1,000 or so average droplets for you to get this. It sounds like an awful lot, but again, it's not. Let me give you another analogy. We're coming to the time where the cottonwood trees are going to be in bloom, and it's always amazing to me when you go around and you see in the street big piles, it looks like snow, that are cottonwood pollen. So you think for the tree, it's the pollens where we're going to go ahead and the seeds are going to make new trees. How many seeds must one tree make? And how many of those seeds are actually successful in growing a tree? The number must be vanishingly small. Otherwise, there'd be cottonwood tree. We couldn't move around for all the cottonwood trees, and there are not that many cottonwood trees, suggesting that the chance of survival for the average cottonwood seed is far less than 1 in 1,000, maybe 1 in 10,000. Think of when you see fish putting out millions of sperm. You'd think we would be up to our necks in salmon, but we're not, because there's so many things that die off along the way. So similarly, when you get 5,000 particles in your nose, certainly not all 5,000 particles are going to grow and cause the disease. And it's thought that of the 5,000, 1 out of 5,000 will actually make it to the right place and give you the disease. So it really is an interesting study in statistics, because it takes a lot of germs for one of them to be able to do it. Now, it certainly is possible that you could have one germ get in, that one germ would be successful, and you could get infected. Just like it is possible that there would be one seed coming out of that cottonwood tree that you would follow as it makes its way down and it would turn into a cottonwood tree, but again, very unlikely. I mean, similarly, if you think of eggs being fertilized, it takes millions of sperm getting at the eggs to be impregnated. If you had a sperm count of 1, you're probably never going to become a daddy. And so it's a law of many numbers turning into one infection or one baby or such. So Deborah says, with the various being more contagious is because it takes less viral load exposure or the virus lasts longer. It appears to be 3 things. One is it seems to adhere better to the connecting site. So if you think of the way this works, is the virus floats around, it has no way to propel itself, so it floats around, and when one of its spike proteins gets to the ACE2 receptor and they hit, then it allows the virus to get in. It's pretty amazing that ever happens, but it does. And it does, and then you get infected. What we think in this is in the variants, few things happen. One is the spike protein with the D614G mutation is stronger. So in the previous versions, sometimes that spike protein would break off and then you couldn't infect anything, and now it's a stronger. With some of these, it adheres better, and in some of these, it actually prevents antibodies and other kinds of things from inhibiting the attachment. So there's probably several different mechanisms. The other question is, are you contagious for longer? We don't know. We do think that people with the variants may be symptomatic for longer. We do not know if they're contagious longer. So we're going to see now, to know these things, what you would need to do is to get the viruses and grow the viruses and study the viruses. It's really, really hard to do that. And the reason it's hard to do that is you can't just grow these in your kitchen or even in a hospital lab. You need to have a special, very high level biocontainment lab, because what you wouldn't want to have happen is to do it in a lab, there would be an outbreak, and then for people to, when you're growing this really dangerous virus, for people to get it. So it has to be done in a very high biosecurity area. So the tests on these new viruses using viral culture technique is slower. So are the symptoms worse with the variant-caused COVID cases? Again, the UK's probably got the best data on this. They did a lot of sequencing, and what they found was that in the variants that likely people were sicker, likely younger people were sicker, and there may have been a higher death rate. Now, it's a little confusing because it matters how you look at it. If you look at people who were admitted to the hospital, by the time you were sick enough to get admitted to the hospital, people with the variant and the other disease did about the same. But the thought was that more people with the variant actually got hospitalized. So we're worried about that. We are seeing younger and younger people in the hospital. So we've done these graphs where we look at the hospitalization rates by age, and now the hospitalization rates for people 70 and above is actually lower than the hospitalization rate for younger people. It's the first time in the whole pandemic we've seen that, and it's scary. So when I talk to friends and I talk to people who work up in Portland, you won't believe how many young people we have in our ICU, and that's a real concern. So Paul says, besides the state data, do you have any update about those vaccinated by the VA or the tribe to indicate that we're not so far behind some of our adjacent counties? So the good news is, Paul, is I do have that data. The problem is the data is not exactly comparable, but I did my best to do that. So let me tell you what I wrote yesterday. So here is the numbers. So when you look at our numbers, and there's lots of ways to look at it, but let's take the number of people 16 above that is eligible to be vaccinated and the number who are vaccinated. So by the state data, it suggests that 34.83% of those 16 and above have been vaccinated. And that puts us at 34.83%, puts us as the 32nd lowest county in Oregon. That really sucks. So, but we did get data from the feds that showed that 11,341 first doses were administered and 8,222 second doses were administered in Douglas County. Now, this does not necessarily mean they were Douglas County residents, because the feds counted by the place of vaccination, whereas the state counts it by the place of residence. So if I get immunized in Lane County by the state data, it goes to Douglas County where I live, and but by the federal data, it goes to Lane County. Overall, it probably evens out, but that's the best we have. But if you had those 11,341 and added them to what we have here, that would add 12% to our total. So we would go then from 34.83 to 46.84. So 46.84. And then if you compared, that would put us above Josephine, above Jackson, above Klamath, above Coos, and above Curry, but below Lane. Rank-wise, if you did this by counties, we would be about where Marion County is, which is about 15th in the state. Now, we'd like to be first in the state, but we're not. First in the state is Hood River County, and Hood River County is at an amazing 61.89. Next one is Benton County at 60%, which is actually a little surprising, and then Multnomah County at 55%. But at 46.84%, it really puts us a lot higher than it otherwise looks. I have brought this up again and again with the state of like the broken record. So I said that state, when they do their briefings, now they say that when they talk about Douglas County, they say their Douglas County numbers are falsely depressed because of this reporting issue, but they don't It's a complicated thing, so it's not on their website. There's probably not a way for the state to adequately add the numbers because of the difference in the federal and the state methodology. Now, the Fed methodology does indeed have the county where everybody who got the vaccine lives. So they could do it, and they just have been obstinate in not doing it. There's a bill in the Senate that would require that the CDC do that. But nonetheless, the numbers for Douglas County don't look as good as I'd like, but they look a whole lot better than if you looked at the OHA website. So I've been such a broken record about this. So they did this state briefing last week, and they pointed out that, we finally got some of this data from the state. Bob Dannenhoffer will be happy with this new data. And then I said, well, but I still would like it included in the alert data. They said, okay, maybe a little less disgruntled. So I would say, yes, I'm happier that we sort of know about this data, but I'm still disgruntled that now months later, we're not doing any better with it. All right, let's go through some more questions. So thank you, Paul. I'm really working on it. So the numbers in some counties look terrible. A friend of mine from Umatilla County was talking today, and Umatilla County is really struggling to get people to get vaccine. And what he talks about is the fact that there's just a lot of people deeply distrustful of institutions, government, healthcare, pharma, anybody else. And that's what we see too, that people are skeptical when pharma says to take this drug or when the government says to take this drug, and I think there's skepticism. What we do know is that the doctors in town, who are not part of any usually big business, I mean, they kind of work for themselves and they work for you, they're all real behind it. And we're going to work next week with the doctors' organizations in town to try and get the word out. So Mary says, I got Moderna 2 days ago and now I have some brain fog. Is that normal? Yeah, for 1 to 5 days after getting the vaccine, to have a little bit of brain fog is not unusual. Ronnie says, is it true that if you've had the COVID, you should not get the J&J vaccine? There's no recommendations to that effect. Again, for people who've had COVID early on, we said, well, why don't you wait a little bit to get your vaccine, because we wanted other people who had no immunity to get theirs first, but now there's plenty of vaccines, so there's no reason to wait those 90 days. So when you're feeling better and out of isolation, you should get your vaccine, and any of them would be fine. So how many of our cases that are positive here are vaccinated? So I pulled the data earlier this week. We had 622 cases since the beginning of March. 2 were fully vaccinated, 4 were partially vaccinated, and 616 were unvaccinated. So again, 622 cases, 2 fully vaccinated, 4 partially vaccinated, and 616 unvaccinated. That would suggest that the efficacy of this vaccine is well over 90%. People have said, well, maybe you could sort of carry the virus with this. Very good studies have been done in clinics, among healthcare workers, first responders, hospitals in the UK and in Israel that showed that if you get the vaccine, not only do you not get sick, but overwhelmingly you don't even get the virus at all. So you don't even get asymptomatic infections. So the vaccine really does seem to be as good as initially promised. So again, how many other cases are vaccinated? Just a vanishing few. We had 1 after I pulled that data, but again, it's 1 out of the last 40. And that's about what you'd expect. 95% effective vaccine, a 90% effective vaccine still means that 1 in 20 will get it. But if it was only the unvaccinated people, if everybody was vaccinated, we would be down to a few cases a week. And at a few cases a week, we could stop doing this. We could stop doing masks. We could stop doing all of it if we were able to get down to a few cases a week and stay there. So Stephanie says, who determines whether a person who dies gets tested for COVID? So we test only people for COVID who have something to suggest they have COVID. So we certainly don't test everyone. We only test people who have some reason for us to think they have COVID. I don't know how many postmortem tests we've done, a dozen or so in the whole time. So we're not testing. We're certainly not testing everybody, but we are testing people for some reason. The reasons might be that they had an illness that looked like COVID. They had fever, cough, loss of smell or taste, something that suggested they had COVID, and then we test them. Or that they are someone who is a family member of somebody who has COVID, in which case they have a pretty good likelihood of having it, and those are the people we test. I can find, in fact, Vanessa, you may know, if you can put it here, the number of postmortem tests we've done. It's not very high. So where did the higher positive cases on Tuesday and Thursday come from, Stacy asks. They were kind of split. We had a few school cases. We have mostly workplace outbreaks. So it's mostly workplace where we're seeing this. Somebody at work has it, they go to lunch with a bunch of people, and then everybody at work gets it. There have been overwhelmingly in unimmunized people, and we've seen a lot of cases in the wood products industry over the last few weeks, and so that's a big concern. So did the quarantine time change from 10 to 14 days? Yeah. So Oregon found that there were some people who were quarantining for 10 days who then tested positive on the 10th, 11th, 12th, 13th, or 14th day. And so, yes, Oregon did change to 14 days. That's problematic because that increases, usually for schools, it means 4 more days out of school, which is kind of a problem. And why did Oregon do this? I don't know why they did this. They just chose to do this. And can I still test out of quarantine? According to the new rules, you cannot, which for us is a bit of a disappointment, but that's the rules. So Megan says, last week you mentioned children getting hospitalized, and would I elaborate? Is it new strains or is it just suddenly hitting children? So Megan, this data comes from back east, where we had where they saw an increased number of cases, an increased number of hospitalizations. The data is especially obvious from Michigan. So Michigan is a state, actually having been there, not totally dissimilar than Oregon. They've got they've got one big and a few medium-sized cities and lots of open land. It's not as pretty as Oregon, but it's still a very nice place. And what they had a peak in the springtime, they had another peak in the wintertime, and then they went down, and then they had just this terrible peak again. And they think this terrible peak is because the B117 variant is now far and away the predominant strain in Michigan. When you look at the data, it looks like of the last 100 they've tested, all have been B117. So B117 really took hold there. So it is the new strain. So yes, it is the B117 strain. And this is what they saw in the UK also. So they saw when the B117 strain hit the UK that they had many more kids and young people in the hospital than they had before. And this is certainly what they're seeing in Michigan. We're not seeing that yet in Oregon. There are two reasons for this, or two postulates. One is that this really affects everyone, but because the seniors are vaccinated, you're not seeing them in the hospital. Or the other theory is that this virus attacks people more evenly by age. So if you think of the early virus, young people rarely got very sick or hospitalized, and then as you got older and older, you were much, 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 much more likely to get sick. The thought is that this may be a little less steep, and that younger people get hit more than others. We still don't know the answer here. I think actually it does hit more kids. We've had more young people in the hospital for us here than we've seen at all. Even if you take out all the old people, we've had a lot more. So Vanessa says we've had about half a dozen to a dozen postmortems, and 5 were positive, and all the positives are household contacts of known cases. So that's how we're doing it. There's a rumor out there that they're testing everybody who dies for COVID, and there are a lot of people who are dying of car wrecks or skydiving accidents that test positive for COVID, and that's where all the cases are coming from. No, it's not. These people we're testing are people who are close contacts or otherwise symptomatic. We had one early on who was somebody who had symptoms very suggestive for COVID. People surrounded him said, "Oh, you should go get tested." He didn't want to get tested and then died. And he got tested. He was actually negative. But those are the kinds of people we are testing. So, yeah. So Sylvia says, can you add the number, percentage of positive cases that have been vaccinated in your daily update? I asked that very question today, and the state is a little leery about having us do that on a day like today. We only have 3 cases. If we said all 3, or if we said one of the 3 was unvaccinated, you might be able to figure out who that was. But I think that's important data, and I have really, really, really pushed for us to include that data, because I think if you said, there were 10 cases, all were unvaccinated. There were 10 cases, all were unvaccinated. There were 6 cases, all were unvaccinated. People will occasionally get the message that, this really does seem to be problematic. And especially when you'd say that 10 of 10 cases were unvaccinated. There were no cases among vaccinated people. Only 50% of Douglas County people have received a vaccine, or whatever the number is. That means that all of these cases are coming from the half that are unvaccinated. Vaccines really work. And that's what I would hope we would do that. I would also hope that the state, when they publish, they say an 82-year-old died from such and such county that had underlying conditions. I would also like them to say they had underlying conditions and they were vaccinated or unvaccinated, because the underlying conditions thing is kind of silly. In fact, I'm trying to find the first person my age who doesn't have an underlying condition, because the underlying conditions now are overweight, BMI more than 25, fortunately me, ever smoked 1 cigarette in your life, probably lots of people have done that, any heart disease, any of the other things. By the time you get to 50 or 60, we've all accumulated a few of these minor things, and then they really do add up. But the vaccination is clear that the people we see with the disease are overwhelmingly the unvaccinated, and that seems to be a real trouble. A couple more things while we gather more questions. Ivermectin, you can basically never have one of these Facebook Lives without talking about hydroxychloroquine and ivermectin. So a friend wrote to me today and sent me 2 websites about ivermectin, and they purported to do meta-analyses that showed that ivermectin works. So what a meta-analysis is, I want to look at all the studies about whether penicillin works for strep throat. And I include all studies that have this, and this, and then look at the studies. Some suggest it really works, some suggest it may not work. And then you add them all together and you get kind of an average of the few. It's sort of the way we do other things, right? In the past, people might have looked at one movie review to see if they would go to movie reviews, if they want to go to the movie. But what you'd find sometimes is you couldn't really find one reviewer that you really trusted. So what do we do look now? We look at Rotten Tomatoes, where they have 100 different people, and you get overall kind of average what the score is. And actually, I find that to be more believable than reading any one person. Similarly, reviews online, they don't just do the one person who was disgruntled. Otherwise, you get the wisdom of the crowds. And so what a meta-analysis is, the wisdom of crowd. You look at all the studies, put them all together and see where they show. Well, unfortunately, these sites that claim to be meta-analyses only seem to pick the studies that said that ivermectin worked. And what a shock when you only pick the studies that say that ivermectin worked, then it looks like ivermectin worked. When you look at all the studies, ivermectin is so hard to tell, because there are some small studies that look like it works. There are some medium-sized studies that suggest it doesn't work. And so what do you make of that? When one says it works and one says it doesn't, it's a little hard to tell. There are a lot of studies which are really hard to interpret. They're sort of retrospective. Like, I took care of lots of people with COVID. I gave them all ivermectin and they all seemed to do well. Okay, well, maybe you were treating younger, healthier people. Maybe the people who got sick in your group you didn't hear from, right? You didn't hear from them. They went to Portland and died in Portland. And so you don't really know on those retrospective studies. Some of the studies are very small, only a dozen or so people. So it's really, really, really hard to know on just a study of a dozen people. So I looked at it again today, did an hour or so of research looking at the ivermectin. And I would suggest that there are some studies that hint that it may work. There are a bunch of studies that hint that it doesn't work, and that overall I can't really tell. There are a couple of other things that are really worrisome in this. There are a couple of people who've made it kind of their life's work to prove that ivermectin works, and they purport themselves to be even-handed scientists, but when you look at their work, again, they don't ever look at any data that goes against it. Second is that many of the studies have funny endpoints, like viral load at the 7th day. I mean, who gives a crap what your viral load is at the 7th day? You really want to know a couple things. Do you get really sick? Do you get hospitalized, or do you die? And the other thing is that people claim this is a miracle. Well, if it's a miracle, miracles are pretty obvious. So when penicillin first came out for pneumococcal pneumonia, it was truly a miracle, and it didn't take very long to figure that out. I think with the vaccines, they really are miraculous, and the data is incredibly strong everywhere you look, suggests the vaccines really work. So I don't really know what to make of it. Really, what we need for ivermectin, hydroxychloroquine, zinc, all of these things, is a good double-blinded study. So that would be, let's say you're looking to see, does ivermectin help if you start it right at the time of diagnosis? That would be a great study, and you'd say, well, what we're going to do is, for the people in the treatment group, we're going to give them a week of ivermectin at a certain dose. For the people in the placebo group, we're going to give them an identical pill that has no ivermectin in it, and then at the end of the time, we're going to see how they did. The person who's evaluating the person doesn't know if they got the drug, and the person who's getting the drug doesn't know if they got the drug or the placebo, and that's what the double blind means. So they're both blinded. In the end, then you look at the data, and if the data in the end show that the people who got ivermectin were much less likely to get sick, then you'd say it worked. If they didn't seem to get better, then you would say it didn't work, and it wouldn't take that many people. It would only take a couple of hundred in each arm to know whether or not it worked. And so that's my disappointment, is that I'm trying to figure out these studies when one well-conducted study using a few hundred people and costing $1 million could tell us the answer. So we spent a lot of time and a lot of effort arguing about whether ivermectin, hydroxychloroquine, zinc, and all of these things work when we really could know the answer. So at my work, Christina says, people are saying that the vaccines are making people go blind or deaf. Oh, I've never heard of that. Can you address if there's any validity, or is it just rumor? Yeah, it's just rumor. I mean, really, truly, if people were going blind or deaf, you would know about it. The VAERS system and other systems would point up about that. You know, we hear about this a lot, where people talk about, there was something last week where somebody says about the 14-year-old who died of the COVID vaccine in Douglas County. Okay, so 14-year-olds can't get the vaccine in Douglas County or elsewhere. And there was no 14-year-old who died from COVID in Douglas County. It's easy to make that, and then people get all worried, but it is so hard to go ahead and put that genie back in the bottle or unring that bell. No, there is no data that's making people go deaf or blind, really, really not. And this is one of the things that we worried about. We worried on the internet that people would say that this would spread around, that people would say, yeah, I've seen that 5 places now, that people go deaf when you get this, when you get that. It's not true. Now, it is true that other drugs that we use, and we seem to use with no care in the world, really do cause you to go blind, especially Viagra, or deaf, Vicodin. So very clearly Viagra can make you go blind, and very clearly Vicodin can make you go deaf. Not very commonly, really rarely, and still some people would weigh the risks and the benefits of Viagra or Vicodin. But how many people have a bad toothache and they need some pill and they say, well, I don't want to take Vicodin because I hear that 1 in a million person might get deafness after they take Vicodin. I don't think so. But in this one, we have 100 million people who've taken this, and there are no episodes of blindness or deafness that have been associated with that. Again, this is one of the rumors that's coming out there, and it's really hard because rumors like this are really hard to debunk. The people here are listening, but the other people who are not listening to this Facebook, but just seeing something on the net about blindness or deafness would indeed be very worried. One of the things we want to talk about was about vaccine hesitance. So vaccine hesitance means that people aren't wanting to get the vaccine. And there's lots of reasons. Some people don't want to be first. Some people are worried about big government. Some people are worried about pharma. And this is all reasonable reasons to be worried. But when you see our data here, 622 cases, 616 unvaccinated, it's incredibly clear that it works. And then when we look at other subgroups of this, like, for example, teachers, similar kinds of data, almost all of our educators who have gotten the disease since March have been unvaccinated. Almost all of our 1A group, which are healthcare workers and other emergency workers who've gotten the disease, have been unvaccinated. And so it's really, really clear that the vaccine works. So certainly never want to make anybody feel bad about getting the vaccine or not getting the vaccine. But if really what we're looking to do is to get back to stuff, the fair, the Pepsi float, music on the half shell, those kinds of things, we need to get these case counts down. And the best way to get the case counts down is by vaccine. So just go get it. We're going to do it. It's so widely available. Almost all the pharmacies in town, almost all the clinics in town have it. We're going to have another big event on May 15th at the Fairgrounds. It's easy to get. Again, there are some side effects. With the Moderna and the Pfizer, there's these rare allergic reactions, clearly some local side effects. And with the J&J, there's some local side effects, some fainting associated with it, and this rare blood clotting thing. But that's it. I mean, they've really looked at it. And so I think at this point, we're like 6 months into it, and I think you can see that these are going to work. So people have wondered, well, why did these things just have emergency use authorizations, and why don't they have full approval? To get full approval, you have to have 6 months of data. They don't have 6 months of data yet. They have 5 months of data. So when they get to 6 months of data, they're going to start looking for FDA approval, full FDA approval. I hope that will convince more people that it's safe. Although I think many of the people who are using safety just don't want to get it. And I'm worried about safety is more acceptable answer than I just don't want to get it. But please go get it. Now, we've done, over the time, we have done some sort of quizzes, the wisdom of the audience. And the wisdom of the audience here is, what do you think would encourage people to go ahead and get the vaccine? And here are a couple of things that have been suggested. So, for example, the governor of West Virginia is going to give a $100 gift certificate, savings bond, to anybody 16 to 35 who's going to get the vaccine. One county in Oregon is doing a pizza party. It worried me a little bit because we're not really into big parties yet, but they were going to do a pizza party. Some companies have offered money, $250. Some people have said, well, if you're vaccinated, then you can travel to Hawaii. So Hawaii is going to, we understand, allow people to travel to Hawaii and not quarantine if they're vaccinated. New York City or New York State has something called the Excelsior Pass. And if you're vaccinated, you get this barcode on your phone and you show it when you get to these places. And when you get there, then you can get into a special seating at the Madison Square Garden. If you're not, you can't get in. So there's different things like that. So I need to know the wisdom of the crowd here. What do you think would work and would not work? So if you could just put them in, and we'll leave this Facebook Live open, or you can just add into the comment section, 2 things you think might work and 2 things that you think wouldn't work. So you might say, yeah, $100 might work, or this might work, that wouldn't work, this would piss me off if you did it. So try and figure out along the way what things you think would work or what things you think wouldn't, because I really don't know the answer to this. And as soon as the vaccine came out, I got it, and many of the people around did the same, but I really need to hear from others. What would be good things to say and not good things to say about this. All right. Looks like that's the last of the questions. It's good. It's time to go. It's Dr. Bob Dannenhoffer. Be safe and be kind. We're going to do this again next Tuesday. At some point this disease is going to get lower. That'll be great. It would be so wonderful when we get down to 1 case a day, some days with no cases, at which point we don't have to be doing this Facebook Live anymore. We don't have to be doing much of these things. If we can get back to many of the other things we're doing. So many kids missed a lot of school this year. It's really hard on a lot of the kids. I see these kids in clinic, and this has not been a really good year for many kids. I see a lot of families, especially families that work in hospitality, that have really struggled in this year. And I see a lot of people who've been really at each other because of this. I really want to get past this. I think the best way to get past this is for everybody to get vaccinated. So please go out and get vaccinated. But above all, be safe, be kind.